Good morning, everyone. My name is David Levine, and I'm the co-founder and president of the American Sustainable Business Council and one of the co-leaders of this initiative. Today marks the release of the Childhood Cancer Cross-Sector Strategies Prevention Report and the official launch of our national initiative. So we're calling for a nationwide effort to address preventable childhood cancers. We believe that now is the time to act as the number of new cases of childhood cancer continue to rise, and cancer remains the leading cause of death by disease for children in the United States. The report that is now available and our speakers today will share the reasons why prevention of the many childhood cancers is possible by reducing and eliminating the production and use of toxic chemicals and products. This initiative is a collaborative effort across sectors to improve children's health by engaging scientists and health professionals to review and interpret research, helping manufacturers, retailers to drive a shift in business practices, and to encourage elected officials to implement responsible state and federal policies. The coalition that we're building seeks to establish a national childhood cancer prevention research agenda and a national childhood cancer prevention plan to eradicate preventable children's cancers through a dramatic reduction in the production and use of toxic chemicals with a strong all hands on deck cross-sector approach. So we're calling for all companies to commit to producing and using safer chemicals, materials, and products that don't make children sick or cause cancer. We're calling on the businesses to support public policies and work with government to pass needed legislation. And we're calling on government to fund cancer prevention research, to monitor children's exposures to toxic chemicals and pollution, to enable appropriate actions, and to pass meaningful legislation that will incentivize safer chemicals and regulate toxic chemicals. Some of the partners in this report and initiative include the Cancer-Free Economy Network, the American Sustainable Business Council, the Children's Environmental Health Network, Max Cure Foundation, Clean Production Action, Lowell Center for Sustainable Production, Made Safe, and a growing number of science, health, parent, advocacy, community, religious, environmental justice, business, and investor leaders. Our speakers today include Ncedu Obat Witherspoon, the Executive Director of the Children's Environmental Health Network, Dr. Philip Landrigan, MD, and Director of the Program for Global Health, Public Health, and the Common Good at Boston College, Dr. Margaret Kripke, Professor Emerita, MD Anderson Cancer Center, Jonathan Agan, Executive Director of the Max Cure Foundation, Katie Huffling, Executive Director of the Alliance of Nurses for Healthy Environments, Juan Paras, the Executive Director of TEJAS, the Texas Environmental Justice Advocacy Services, Mark Ruffalo, Emmy Award-winning actor, activist, and producer, Joey Bergstein, CEO of Seventh Generation, and Kelly Velakis Hanks, CEO of ECOS. After our speakers, we will turn to your questions, so please feel free to write your questions in the Q&A or chat box. Most speakers and other experts will be available for more in-depth interviews after. So now I will turn it to Ncedu Obat Witherspoon, the Executive Director of the Children's Environmental Health Network. Nce?
Thank you so much, David, and thank you everyone for joining us today. Over the last 20 years, my work to protect children from known environmental hazards had shown me that to fully understand the scope of the problem and the opportunities for action, we must first understand the whole picture. Cancer is now the largest cause of death from disease among children in the United States. The incidence rate of childhood cancer, and that's the number of new cases per 100,000 children, has steadily increased 34% since 1975. The purpose of this report is to provide a foundation of information to catalyze collective action among various sectors to reduce risk and protect children from harm. The lack of acknowledgement of the link between environmental exposures and childhood cancer stems from a lack of understanding of the state of the evidence. The vast majority of childhood cancer research funding goes towards studies of cancer treatment and survivorship, leaving only a small portion for the critical work on prevention. What we do know is that an experiment has unfolded over the last decades in which children are exposed to toxic chemicals in consumer products, in water, in food, and in the air that they breathe. Our team conducted a search of the peer-reviewed science indicating the contribution of environmental chemicals to the development of childhood cancers. The review identified 3 categories of chemicals: pesticides, traffic-related air pollution, and paints and solvents, for which there's robust evidence suggesting links between exposure and the most common childhood cancer types, including brain tumors, leukemias, and lymphomas. Also of great concern are preconception exposures by both parents during pregnancy from exposures to the mother and during early childhood. Our review included other chemicals known to cause cancer in adults, many of which are present where children live, play, and learn. These chemicals may also expose parents in workplaces, potentially passing around additional risk to their children. As of yet, few studies directly link these chemicals to childhood cancers, but this absence of evidence reflects the difficulty of studying environmental contributors to rare diseases. It does not mean that exposures to carcinogens are safe for children. Where exposures to children are plausible, these too should be priorities for prevention. Researchers estimate that up to 10% of all cancers in children ages 0 to 19 derive from heritable genetic risk factors. For many of other cancers, hazardous chemicals are among potentially preventable risk factors. Successfully treating increasing numbers of cancers cannot replace making the urgent progress on prevention. Our analysis acknowledges the disproportionate exposures to hazardous chemicals among children who live near fence-line communities, industrial manufacturing, agricultural facilities, major transportation routes, or hazardous waste sites. We recognize the risk factors related to poverty and racism in these communities, which heightens the risk of chronic disease among children. In order to address the rising incidence of childhood cancer, we must act urgently and decisively to confront and address the root causes. We are calling for a national agenda to prevent childhood cancer. This plan requires the support of people in every sector of our American society. In the prevention plan, we must require that all new chemicals that are widely used and existing chemicals be tested for their safety and toxicity. We can no longer allow our children to be exposed to thousands of chemicals of unknown hazard. We must support strong research programs that include epidemiological and toxicological studies. We must strengthen the state and federal laws and enforce these laws to better protect our children. We must work with the business community to develop new green chemicals that will sustain our society without harming future generations. Last week, the Cancer-Free Economy Network released the first ever joint statement on cancer prevention, supported by key health professionals, public health, and cancer-focused organizations. In alignment with this historical statement, we are calling for dramatic and equitable transition away from hazardous chemicals to safer alternatives at the scale needed and required. Such action is required by business, community institutions, and our government. Thank you.
Thank you, NC. Now it's my pleasure to turn to Dr. Philip Landrigan, MD, and the Director of the Program for Global Public Health and the Common Good at Boston College. Dr. Landrigan. So you're on mute. Yes, thank you.
Thank you, David, and thanks to all of you who are here today. I'm going to speak to you as a pediatrician. So what do we know about childhood cancer? The first thing we know is that the incidence of childhood cancer has increased by about 35% since we started keeping national records in the early 1970s. The death rate has gone down because we've made a massive effort to learn how to treat childhood cancer, and that effort has been extremely successful. But even as we've been reducing the number of children who die from cancer, the number of new cases has been increasing inexorably year to year to year. At the same time, over the same 50-year period, the number of chemicals to which children are exposed in the environment has gone up from year to year to year to year. And today, there are more than 85,000 chemicals in cars. What do we know about these chemicals? We know from research in animals, from epidemiologic studies, that hundreds of these chemicals can cause cancer. And we know that children are exquisitely vulnerable to toxic chemicals, much more vulnerable than adults. Even small doses, even low-level exposures during pregnancy and in early childhood can cause cancer in children. And we specifically know that certain chemicals like benzene, 1,3-butadiene, certain pesticides can cause leukemia, can cause lymphoma, can cause brain cancer in children. These are established facts. These are accepted by government, by industry, by the World Health Organization, by the medical community. There's no doubt about the fact that chemicals can cause cancer in children. And yet, we continue to allow children to be exposed to known carcinogens. And we also foolishly, recklessly allow new chemicals to come onto the market every year with no testing for safety, no testing for toxicity, no testing for their ability to cause cancer in children. This is madness. This is absolute madness. It is a recipe for societal suicide. We have to do better. So that's why I'm here today, joining with all of my colleagues, calling for a new agenda. And in fact, I speak of the need for a second front on the war on cancer. President Richard Nixon many years ago declared war on cancer. That war has put billions of dollars into research on cancer treatment, but we've neglected cancer prevention. Only 2 or 3% of all the money that's gone into cancer research over the past 50 years has gone into prevention. We have to do something about this. So I think, first of all, we have to take action, immediate action, to halt children's exposures to known cancer-causing chemicals. There is no excuse scientifically, no excuse morally, no excuse ethically to allow children to continue to be exposed to chemicals that we know cause cancer. And then secondly, we have to enforce meaningful legislation in the United States of America that requires every single chemical that's coming onto the market to be tested before it comes to market. And we also have to systematically go back through the chemicals that are already on the market that have never been tested, starting with the worst first, to test them for cancer-causing potential and remove the chemicals that need to be removed. This is a question of balancing human life against chemical industry profits. And as a society, we have to ask ourselves, which side do we come down on? Do we value children? Do we value profits? We have to make a choice. We have to make a decision. I think the answer to the decision, very clearly in my mind, is that we have to protect children. I hope that you'll agree and that you'll join with all of us in making this happen. Thank you, David.
Thank you. And what we know, and you'll hear from business leaders later on, is that you can make profit and increase health in children and families and communities and the environment across the country. Next, it's our pleasure to turn to Dr. Margaret Kripke, Professor Emerita at MD Anderson Cancer Center. Dr. Kripke, please.
Good morning. I became interested in the issue of environmental causes of cancer a few years ago while I was serving as a member of the President's Cancer Panel. And one year we decided to look at the contribution of environmental chemicals to cancer incidence. Well, initially I was not very enthusiastic about this because the common wisdom in cancer research was that only about 6% of all human cancers are caused by substances in the environment and in the workplace. So it didn't seem to me to be a very compelling issue. However, it turned out to be an incredibly eye-opening experience for me, mainly because I started out with a number of assumptions. First of all, I assumed that chemicals were tested before they were released to the public. And as you just heard from Dr. Landrigan, that's absolutely not true. And it's because in our country we use the reactionary approach to regulate the reactionary approach to chemical safety. And we only regulate chemicals after they have shown to be harmful. Other countries use the precautionary approach, which requires proof of safety before release. And so in our country, there are very few incentives for developing safe alternatives. I also assumed that known carcinogens would be regulated. And again, as you heard from Dr. Landrigan, this is certainly not true. And around 30 or so pesticides in common use have been shown to be cancer-causing substances. And this is not a problem just for agricultural workers. These substances end up in homes and in gardens and in the food supply and in the water. And so not all carcinogens are regulated. And I also assume that when substances are regulated, the regulations would be enforced. And again, this is an assumption that turns out not to be true. So we were quite astonished with the results of this report, and we wrote that 6% was likely to be a serious underestimate of the contribution to chemicals to cancer incidence, and this was likely to be a very much larger problem than anyone was willing to admit. And of course, it was a very unpopular conclusion, but if I think what my life was like when I grew up, the differences are extremely striking. We did not use an exterminator. We didn't have herbicides. We had no non-stick pans, no styrofoam containers, no flame retardant pajamas, and few household commercial cleaning products. So I couldn't help but wonder, what is the impact of all of these chemicals on human health? And why is it that the incidence of childhood cancer and birth defects has been increasing for the last 5 decades? And why is it that the onset of puberty has been occurring at a progressively younger age? And why is it that in the current epidemic of breast cancer, more than 80% of the women have no family history of the disease? Could these be related to the ocean of chemicals in which we now live? With all these important questions needing to be answered, we have to ask ourselves, why isn't environmental carcinogenesis a more prominent issue in cancer research? Well, for one thing, it's difficult to study. Epidemiological studies are very expensive and take a long time. It takes a long time to see the impact from a preventive measure. Think about how long it took for us to see a reduction in lung cancer incidence after the reduction in smoking. And there's little federal funding and almost none from industry to support research on this subject. And of course, that's where most funding for cancer research comes from. And most importantly, as was mentioned, cancer research today is focused on cures, and little funding and little attention is focused on prevention. Now, obviously, both approaches are necessary. It's impossible to prevent all cancers, and we all want to see better, less toxic treatments. But reducing the incidence of cancer should also be a priority. Preventing cancer has the potential to affect large numbers of people, especially children, and has the added benefits of sparing them from the emotional, physical, financial consequences of cancer treatment. And that is why this call to action by the Childhood Cancer Prevention Initiative is so important. It lays out the recent, growing scientific evidence that chemicals in our environment are important contributors to cancer development in children, and it outlines specific actions that can be taken now to reduce childhood cancer by decreasing their exposures to toxic substances in our environment. Thank you.
Thank you, Dr. Kripke. And now we turn to Jonathan Agan, the Executive Director of the Max Cure Foundation. Jonathan?
Thank you. Your child is cancer. These are 4 of the most terrifying words that any parent can hear. In April 2008, my family heard these words about my 27-month-old daughter, Alexis. They were immediately followed by the words, "I'm sorry, she only has 9 to 12 months to live with the best treatments available." As you just heard, my name's Jonathan Agan. I'm the Executive Director of the Max Cure Foundation, which is a national childhood cancer nonprofit organization with a mission aimed at funding research, providing family support of the financial nature to low-income military and first responder families with a child diagnosed with cancer and active treatment, and advocating for policy change. In January 2011, my daughter Alexis took her last breath on earth. She was killed by childhood cancer. She did not grow angel wings and gently leave this earth. She was stolen by the #1 cause of death by disease for children 19 and under in the United States. In 2015, as a result of my daughter's experience, I left the full-time practice of law and began my path towards this very moment today. My story is not unique. Statistically, 1 out of every 285 children in the United States will be diagnosed with some form of cancer before the age of 19. At least 7 families each day will watch their child take their final breath. And since 1975, as you've already heard, there has been a 34% increase in the incidence rate of childhood cancer in the United States. Despite the often false images of smiling, bald-headed children surrounded by celebrities in the hospital, living happily ever after, the reality is a far more troubling one. Thanks to one of the most motivated human beings I know, MaxCure board member Ann Robertson, and her ability to convince our late Vice Chairman Richard Plotkin to look into the issue of prevention through the reduction of chemical and environmental exposures, we find ourselves at the gateway to addressing this issue head-on in a durable fashion. The realization that external and controllable factors, such as the release of tens of thousands of toxic chemicals in the environment and within consumer products, is in fact creating a rise in the number of children being diagnosed with cancer. And this is enough for us as an organization to join with so many to take definitive and unequivocal action. Action focused for the first time on a significant scale aimed at the prevention of childhood cancer. Within the childhood cancer community, the overwhelming focus has always been placed on finding a cure. And MaxCure, which has previously invested over $1.6 million into research funding to create less toxic and more effective therapies, was no stranger to this almost singular focus. The time is now, though, to act upon the science and evidence that is overwhelmingly demonstrating the need to focus immediate attention on the issue of preventing numerous forms of childhood cancer through the reduction of the use of thousands of toxic chemicals and the associated damage to our environment. By focusing on prevention of childhood cancers through common sense measures, not to supplant the need to find real cures, but rather to ease the overall burdens associated with the diagnosis in the first place, a more symbiotic relationship is created. Prevention and cure must be seen as siblings rather than cousins, spoken of in the same breath. We must undertake a distinct and specific effort to reduce cancer-causing exposures, as well as to understand how such exposures may be helpful in guiding families faced with childhood cancer to the selection of more effective therapies. Ultimately, the issue of prevention and the search for a cure are but two spokes on a bicycle wheel that originate from the same hub, that is childhood cancer. In the end, prevention is in fact the greatest cure of all. Today, we're calling for action for everybody to join within this initiative to take common step measures to reduce the exposures that our children are getting, which are leading to the diagnosis of cancer. Thank you very much.
Thank you, Jonathan. And now we'll turn to Katie Huffling, the Executive Director of the Alliance of Nurses for Healthy Environments. Katie?
Good morning. When I was in nursing school, my pharmacology professor made a comment about chemotherapy that's always struck with me. She said, years from now, when folks are looking back on how we treated cancer, they'll say, how barbaric. I'll often think about that comment when I read things like the rates of childhood cancer are increasing by over 34% since 1975. Or when I think about the children and families whose lives are changed forever due to this cancer diagnosis. Yes, we've witnessed such advancements in cancer care, and now more children are surviving a cancer diagnosis than ever before. But at what cost? Not only does a childhood cancer diagnosis carry a tremendous emotional, physical, and financial toll for children and their families. Children who beat the odds, who make that statistic of less children dying of cancer a reality, are too often left with lifelong health issues. The properties in many chemotherapeutic agents that make them so effective at killing cancer cells make it easy for them to damage healthy cells too, especially in children whose little bodies are still growing, changing, and developing. Cancer treatment in early life puts children at increased risk of developing diseases as adults, such as infertility, cardiac, respiratory, or renal disease, and increased risk of a secondary cancer occurring. But it doesn't have to be this way. As highlighted in this new report, the science is clear. When we remove toxic chemicals from products such as solvents and pesticides, and reduce exposure to the myriad of toxic chemicals and air pollution, we have an amazing opportunity to help prevent cancer in children, to prevent more families from hearing the words, "Your child has cancer," to prevent the costly emotional and financial burden of cancer treatment. As a nurse, a core part of my job is to help children and families be as healthy as possible. It's really hard to do my job when children are being exposed to numerous cancer-causing chemicals every day. It's hard to do my job when I'm not sure what advice to give when parents ask what products are safe to use with their newborn, or products are safe to put in their child's playroom. It can be incredibly challenging to know what advice to give when so many chemical ingredients haven't been tested for safety. Nurses across the country are calling on policymakers and manufacturers to make prevention a priority. We can make developing safe ingredients a priority. We can make testing current chemicals a priority and quickly removing those found to be toxic from our products. As this report makes clear, the time for strong, bold action is now, and our future generations are counting on us. Thank you.
Thank you, Katie. And now we'll turn to Juan Parras, the Executive Director of TEJAS, which is the Texas Environmental Justice Advocacy Services. Juan, please.
First of all, I appreciate all the comments I heard, especially comment from medical professional people that service our communities. I'm going to tell you something that I often say, and this is not to be insulting, but to make a point. I tell folks that here in Houston, we have probably the best medical center in the world that addresses cancer issues. In fact, people from all over the world come to our hospitals here to be treated for cancer. And I tell folks that, yes, we know how to address cancer issues, but we don't know how to prevent it. You know, we focus on a cure instead of prevention. And along the Houston CHIP channel, there's a 56% higher risk of childhood leukemia. And we know what causes leukemia. But again, we'd rather address the cure instead of, again, what we're all talking about right now, about solutions, right? Get rid of some of those chemicals that cause cancer. We also, I want to tell you that we're an environmental justice community, and we talk about fence line communities because fence line communities are the most vulnerable when it comes to being exposed to chemicals. There's another study that was done here in Houston where the community of Manchester is exposed to 12 hazardous air pollutants, 7 of which are cancer causing. That's a lot of valuable information again, but what does it in fact do for those communities that live in Manchester or who live within a 2-mile radius of the Houston CHIP channel and have a 56% higher rate of contact and childhood leukemia? Again, I'm just trying to address the issues that you care about and the issues that impact us at different levels. And it would be crazy for us to suggest that, okay, if you live within a 2-mile radius of the Houston CHIP channel, you all need to be relocated. That doesn't solve the problem because those chemicals still exist and they travel beyond 2 miles, you know. There's issues that we have with the Texas Commission on Environmental Quality. In some cases, when we address fence line communities, and they want to say, well, if you live beyond a 2-mile radius, you don't have status. Well, you know, that's ridiculous. That's not good science because, again, air toxins affect us farther than a 2-mile radius. So I'm glad to be here, and I'm glad that this is a discussion that I feel that is finally taking place, where we in the fence line communities, we are not critical of the industry and we're not critical of scientific research, but we need to address how to get rid of chemicals that cause those injuries or harm to individuals, and not talk about a cure. Yes, we need a cure. That's very important. I'm glad that we have, you know, curable diseases that we can address, but we've got to combine both and spend as much research on a cure as in prevention. And I want to thank you for your time, and I appreciate being here with you guys.
Juan, and thank your community for its ongoing work to address these issues. Now we turn to Mark Ruffalo, the Emmy Award-winning actor, yes, and activist, and for a long time activist and producer. Mark, thank you.
Thank you for having me and on this panel. It's wonderful work you're all doing, and it's sad. 11,000 children under the age of 15 will be diagnosed with cancer this year. 10% of them will die from cancer. You know, I've been all over the country, whether it was making a movie about PFAS and the poisoning and contamination of every single one of us by the DuPont company, or fighting on the front lines of hydrofracking. In all of those communities, you know, there's incidence of cancer, rising rates of cancer in children, phantom cancers, cancer clusters, and a lack of study as to how this is happening. We do put most of our attention on the money-making dimension of taking care of cancer, not curing cancer, but the therapeutics for cancer. But very little funding goes to the actual understanding of how people are getting it. And we're dealing with industries that don't want us to know, whether that is an insurance industry that makes a lot, in medical industry, a healthcare industry that makes a lot of money off of dealing with cancer and treating cancer, or the industries that are using these chemicals. The one thing that I've seen repeatedly is a kind of another kind of disease, another kind of cancer, an undiagnosed disease in America, which is the disease of greed. And that disease is keeping us from addressing these issues at their root cause, which is that we do not use the precautionary principle in the United States. We wait for people to get sick, and then those people have to prove that any given chemical or substance that they've come into contact with is what has made them ill. It's different than every other industrialized modern nation in the world, and therefore we have the high incidence of cancer. Now, this is a major problem. You hear the whispers of sacrificial communities, sacrificial people. The receiving end of that is our children. And for this economy, for constant economic growth, for money, we have made the trade-off of our children for this system, this economic system. And it's a perversion of our democracy, where our democracy has become in service of capitalism instead of capitalism becoming in service of democracy. And so, if you had something like a universal healthcare system, you wouldn't have profits being made on people being ill, which would make the laws change to protect the state and the amount of money that is being made off of either creating the chemicals that are poisoning our world, or having to make right in the bodies of children the poisons and the diseases that those poisons have caused. And so we're at a moment of critical thinking and justice of what we want to be as Americans. And these issues are on the very forefront of how we're going to move forward in a more humane, more just, and safer way, not for us, but for the coming generations. This problem is only becoming exacerbated. It's only multiplying. And as we bring more and more chemicals onto the market without understanding what those chemicals do to us, this problem will only get bigger and bigger and bigger. It's out of control now. And so I hope that we can talk about the systemic root of these issues as we move forward. We have to be clear-eyed about this. It is the basis of this problem. Thank you.
Thank you, Mark. And now, dear to the American Sustainable Business, Council's, efforts to drive a new business understanding and movement in the country are two exemplary leaders that we'll turn to now. So now, Joey Bergstein, CEO of Seventh Generation. Joey.
Yeah, thank you, David. And thank you, everybody who's spoken. It's really powerful conversation. And what I just love to say is that I do think there's a role for capitalism to play in addressing the issue that is in front of us today, but conscious capitalism. Conscious capitalism must play a role in creating safe, effective products for people and preventing the kind of escalation we've seen in childhood cancers and all cancers, to be frank. Seventh Generation, we make safer, eco-friendly home care products. Our name is inspired by the great law of the Iroquois, which I think is really relevant today, that in our every deliberation, we must take into account the impact of our decisions on the next 7 generations. What we're facing with childhood cancer is the unintended consequences of just innovating without thinking about what happens at the end of the life of these products and the bioaccumulation of toxic chemicals inside products that people use every single day. As a company, our philosophy does embrace the precautionary principle. We won't use ingredients that we don't know to be safe for people and for planet. And beyond that, we advocate for that kind of a change in policy. And so stood up in the safer chemical laws to really try to address the weak chemical safety laws that have been in place in the country. They're stronger today, but they're not strong enough, and they need to be even stronger as we go forward to really ensure that we have safe products that are in front of people. But more than that, in the meantime, we need companies to shift the way that they're thinking about how they create products. Right now, most companies take a risk-based approach to identifying what ingredients they're going to use in their products. What happens, can they use an ingredient at a safe enough level in order for it to be effective, which is the opposite of the precautionary principle. What they need to be taking is this hazard-based approach and saying, well, any level of carcinogen or endocrine disruptor in any product is too much because we don't know the effects of bioaccumulation, or maybe we do, and maybe that's what this conversation is really all about. And for the capitalists among us, this is a real matter of a business imperative. Consumers are losing trust in companies today. They are putting trust in companies that are taking this kind of approach. And companies who are formulating safer ways, that are thinking about people and planet, are seeing growth that accounts for the vast majority of the growth that's in the marketplace today. The consequences of not taking that are being seen also. So you've seen what's happened with Johnson & Johnson with their baby powder legislation, the class action lawsuits with Johnson & Johnson, with Monsanto and Bayer and Roundup. Juries no longer have patience for companies that aren't taking that approach. And they are awarding very big penalties to companies that aren't subscribing to the precautionary principle. So I think it's very clear that this is really the only way for us to do business as we go forward. And then the last couple of things I would say is that business has a role to play, not just in formulating safe and effective products, but also advocating for the policy that ensures that we're all held to the same standard, to that same standard of creating effectiveness in a safe and powerful way. And then, lastly, I just say that the 7 generations, we've been around for over 30 years. We became part of the Unilever organization about 4 years ago. And I'm really proud that they made an announcement around how they're shifting their approach to creating home care products globally. They've got a $10 billion business around the world in home care products, and have described what they're terming their Clean Futures program, and shifting their approach to chemistry to be very consistent with the conversation that we're having today. So I remain really optimistic that it's not just a collection of the smaller businesses that are out there, but big businesses are really prepared to step in and step up. But we need to continue to raise our voice and to ensure that other businesses are joining this chorus and doing business in the way that business really should be done.
Thank you, Joey. And so now we'll turn to Kelly Velakis Hanks, the CEO of ECOS. Kelly?
Thank you, David. It's so wonderful to be here this morning with each and every one of you. We have been making safer cleaning products for over 53 years, and we're committed to always using the greenest and safest ingredients in all of our cleaning products. And I believe wholeheartedly that businesses need to take a long-term approach and think about the health and wellness of their consumers to truly have a sustainable business model. We have to move away from the ideas of short-term capitalism and short-term profits. I think it's very short-sighted, and those businesses will never win in the long run. The cleaning products industry is an important role to play in the prevention of cancer. Each and every day, people are bringing cleaning products into their homes in an effort to protect their families. But cleaning should not mean spreading toxins all over your home. And sadly, right now, that's exactly what it does mean. In 1970, when the EPA was created, they grandfathered in 82,000 chemicals. Only a few hundred have been checked for human health and safety since that time. And so many of these ingredients are found in our everyday cleaning products. So consumers need more transparency. It's a shame that the United States is one of the only countries in the world that does not require the disclosure of ingredients in cleaning products. When consumers walk into our grocery stores and they look at the back labels of products, they have no idea what they're bringing into their homes. And yet every day you wash your plates, you wash your glasses, and the cumulative effect of being exposed to the residue on your plates, on your glasses, on your clothes is definitively linked to so many cancers that are so prevalent in our society today. And so we need to do a few things as businesses and as consumers. Number one, as Joey talked about, we must formulate with safer ingredients. They're available. There's renewable and replenishable ingredients. Companies need to be smarter. They need to think about the long term, and they need to be innovating with those safer ingredients. And number two, we need to make sure that we're educating our consumers. We need them to know that just like you would read the ingredients when you purchase a food product you bring into your home, you need to read the ingredients of the cleaning products you bring into your home. It's about what's in you, on you, and around you. And all three of these areas need to be addressed. We need to make sure that we're fighting for things like the Cleaning Products Right to Know Act that was passed in 2017 here in California. In California this year in 2020 became the first state in the nation to require disclosure of ingredients on cleaning products. But it's not enough for just one state. We need our entire country to follow suit if we're truly going to protect the health and wellness of our children. We need to empower the consumer to do something to protect their family. And I think that we need to ensure that companies champion this change. It cannot just be the government championing this change, the medical community, nonprofit organizations, businesses have to do the same as well. We need to be at the forefront of advocating for our consumer and advocating for the health and safety of all.
Thank you, Kelly. And thank you all panelists. So if folks have questions, please put them in the Q&A. And, what I just want to reiterate what you heard here today is that, our plan to move forward with a national childhood cancer prevention agenda and plan, but it focuses, our key asks today are to produce, from companies, to have them produce the safer chemicals and products, for consumers to be purchasing those safer chemicals and products, for us to have government invest in prevention research, for us to advance public policy to incentivize safer chemicals and products, and for us to support and expand regulations to reduce known causes, not to eliminate the kinds of protections that we've had in place, but to actually expand them and to find the ways to actually drive an economy that protects the health and well-being and also grows business. So please type your questions in the Q&A and we'll take it from there. One question is, what is the role of the federal government in preventing childhood cancer? And which are the government agencies responsible for this? Jonathan, do you want to jump in and address this a bit? And then maybe Ense, you want to add a little bit?
Sure. I think the federal government has a true imperative to join in the discussion with respect to the prevention of childhood cancer. Federal government is the top funder of research for childhood cancer. If you look at the burdens caused and created by childhood cancer, both on the family and on the federal government, it's a no-brainer. With respect to the toll that childhood cancer takes on a family, the years lost when a child is diagnosed with cancer it's 71 years on average of life lost when a child passes away from cancer. That's a huge burden on the economy. If the federal government can be the #1 funder of childhood cancer research through the National Cancer Institute, then this discussion can move to accelerate the focus within where the research dollars go. And the overall reduction in the burdens to the federal dollars that are put into research for creating new therapies, for creating less toxic drugs, that can all be alleviated on a large scale if we can funnel more research money into the effort at prevention. So yeah, I think it's an imperative for the federal government to join with us, and there's a great vehicle within the Congressional Childhood Cancer Caucus where these conversations can begin. And as nonprofits and as all these organizations that have joined together, it's within our power to raise this issue on the level so that the federal government does in fact get involved and can shift the focus some.
Great. Ense, did you want to add anything to this?
Thank you. I appreciate all that, Jonathan. I just want to call out something very blatant that we've been seeing for a long time now. We have this vicious cycle in this country of waiting for crisis to occur, and then we are all looking around and trying to figure out where our public health infrastructure is. And we're seeing this play out in our lives right now with COVID-19. The underfunding of public health and our public health and preventive aspects has been a symptom of a problem in this country for decades, and we continue to see the roots of it when we need our public health infrastructure the most. Attacking science is also something that's become a thing to do. You cannot attack science when the science continues to evolve and continues to show the trends in the directions that may not be as convenient, depending on the industry you're surveying, but still doesn't make it wrong. And we've sadly seen this happen under this current administration. And the rollbacks to our air quality, our water quality standards, and many other public health provisions are a problem. We are going to have, many of us are fighting these daily, weekly, but the ramifications of this will also continue to add to the burden that our panelists have been talking about. Our EPA is set up to protect our public's health. It is supposed to be our regulatory agency. It is not able to currently, in my opinion, do its job effectively if it's constantly undermined and not funded, and it is reduced significantly in the workforce. We need a trained public health workforce of all kinds across our federal government, our city government, and I'd like to also call out our public health departments as well. They are sorely underfunded and need trained professionals so that we can enact when possible and have the type of partnerships necessary for the treatment and reducing the severity of illness and disease that is currently happening, and as we're all saying, prevent illness in the first place from happening.
Right, and what you're hearing from this initiative is that we're calling upon everyone to raise their voices, whether it's business leaders, investors, parents, health professionals, and the like, to join us and putting pressure on our government to do the right stuff. We need to build up our collective collaborative effort. Here's the next question is, what is the percentage of doctors who understand this issue, and how open is the medical community as a whole to drive a preventative approach to childhood cancer? Dr. Landrigan, do you want to field this question?
Yes, David, I'm happy to. So I think the answer is not enough doctors are aware of the contribution of environmental factors to childhood cancer and other diseases. But the good news is that the percentage is growing because groups like the American Academy of Pediatrics, the American College of OBGYN have been pushing hard for the inclusion of information on environmental causes of disease in medical school curricula. And certainly doctors in training today are getting a lot more information about these issues than doctors of a generation ago. But there's still room to go, and we have to go harder. I also want to make a comment in regard to the previous question about the role of government. My colleague spoke about the need for the federal government to step up. I agree completely with that. But that's not the only place to act. The big states, Kelly mentioned action in California. Big states like California, like New York, like Massachusetts, like Texas, are so big that if they get together and take action, they can move national markets. And in times like now, when the federal government is paralyzed by special interests, there's a real role for the states to step up. And we have to remember that as we plan how to protect children against toxic chemicals.
Great. And Katie, did you want to speak on behalf of the nurses?
Sure. I think it's, similar to physicians, we definitely can be doing better with education. However, environmental health is a core part of nursing practice. It's part of our scope and standards of practice. And with nursing's holistic approach to health, I think many nurses are strongly behind prevention and are increasingly educated about the role that environmental exposures take in cancer prevention.
Great. And we have a question, which is what might be a good focused area to begin with for families wanting to take action to prevent cancer? Bobby Wadling, you're also on the call here from Clean and Healthy New York. Are you able to unmute and to take that?
I'm here. Can you repeat the question briefly?
Yes, we're asking what kind of actions can parents and families take to prevent cancer?
Absolutely. There are a lot of things that we can be doing, whether it's taking advantage of state laws like what New York and California are advancing to know what's in your products and actually look for products that are made without harmful chemicals. So looking for labels like Made Safe and GOTS Organic Certified. Those are things you can do for your own home, but really you can join in with organizations like ours, like all of the groups that are here represented today, to raise your voice for change. And we're seeing that happening, as Dr. Landrigan just mentioned, all across the country, and that can happen at the federal level as we apply pressure and make those demands clear. And I think that every place that you're involved in your life, whether you're talking with your church about the policies they have for what cleaning products they're using, or you're talking with your schools about those same questions, there's a way to engage the institutions in your daily lives, and ways to take action on a broader scale for change for all of us.
Great, thank you for that. So there was a question of, dealing with these issues during COVID and the like. So, but before we take that, I just want to make sure, up on this screen now, we have a way for you to get and write us via email, also to get in contact with the initiative, also use those links to be able to download the report. And so that you have access to the report and you can get in touch with us and we can continue this conversation. Because as we've been saying, this is a cross-sector initiative, in essence, meaning all hands on deck. We all need to be joining together in order to have a collective impact together. So, one of the questions is, given what's going on with COVID and the use of some of the chemicals used to address and to sterilize and the like, is there something that we could also be thinking about at this moment? And are there resources out there to prevent the use of toxic chemicals as we're trying to prevent COVID? Does anyone want to grab that one?
I would love to say a few things about that, David. I would, first of all, really caution everybody to clearly read what the CDC is asking people to do in their homes. They're saying, number 1, clean, and number 2, disinfect. They're not saying clean your homes with disinfectants. And I think it's really important to understand that and to go to their site and to read the language, because one of my concerns right now is that the pendulum is going to swing too far. People are, in an effort to protect themselves from COVID, they're creating all sorts of long-term issues for lung health by creating such poor air quality inside of their homes. Before COVID even took place, we knew that indoor air pollution was 5 to 70 times greater than outdoor air pollution. And this is where we're spending so much of our time today. So I would really encourage people to clean first and to clean with safer cleaning products, products that bear the US EPA Safer Choice certification, products that have other green certifications so that you know that you're not harming your family additionally by overdoing it with very dangerous disinfectants.
So I want to just thank all of you that have joined us on the call today, and particularly, thank, all the presenters and the many others that have participated in the creation of the Childhood Cancer Prevention Report and have joined us in this initiative. We've got a lot of work before us, but we believe that by being able to come together, right, a call that we need, not just to address childhood cancer, but the many issues that we're facing in this country together. It's in our diversity, it's in our strength of being able to come together to raise our voices to enable these shifts to take place. So we can create a world in which, yes, there's businesses that are thriving, but there are policies in place to help to protect us, incentivize good behavior. But what we're doing is creating a healthier and safer environment and safer and healthier products and chemicals, because it is possible for us to do it. So childhood cancer, many of these childhood cancers are preventable, and we need to take action today, need to take action now, and as has been said, and we need to take it for generations to come. So thank you all for joining us today, and join us in this initiative to address childhood cancer prevention. Thank you, and have a good rest of the day.
David, are we leaving? I wanted to say
Thank
something.
you.
Thank you all. Thank you, David, for doing this.
Thanks, everybody.
Thank you, everyone.
Thank you, Mark, for funding the Condor and the Eagle.
Thank you, everyone. Thanks, Juan.